Blog Talk Radio.
Hi, and welcome to MindShifters Radio with the Forgiveness Doctor, Dr. Michael Ryce. And we have a special co-host today, Dr. Stephen Androcki. And so we are really excited and ready to get on this. The call-in number is 646-200-4169. And we already have a question. Why a medical doctor on your show?
Well, hey, welcome to the show. We're delighted to be sharing with you, and we do have Dr. Stephen Androcki, who's the reason we've been in Las Vegas for, about a total of 10 or 12 weeks now, this particular tour. We've never spent that much time in a city before, and we have in front of us an awesome healer and a gentleman who's actually prescribing forgiveness to his patients and been introducing people by the dozen to the process of forgiveness. So that's why Dr. Androcki is with us, and I'm going to introduce him and let him share what he has to share to start with, and we'll carry on the show from there.
Okay, I'm a medical doctor. I've got a medical degree and been practicing for quite some time, almost 20 years. And the question is, why not a medical doctor? I think that the work that Michael promotes is for everybody, and I think that it's all of our responsibilities to share the work with the people who are in need, and that's what I do. As a matter of fact, people come to me in need. That's my sole purpose, is to help people who come asking for help and assistance, and a lot of times the issues surround depression, frustration, stress, that have a direct relation to their medical condition. It becomes clear when talking to the patients why they are feeling the way they do, why they may not be sleeping properly. And a lot of times it's just asking them questions. At first they deny that there's any association with their problem and anything that's going on inside them. But usually with a couple of questions that it becomes apparent that their issue is due to something that's happened or they perceive to happen to them in their life, and that needs to be fixed, or they're going to continue with their same symptoms, and that means that a pill is not going to correct their issues. And this goes in many different situations. Some simple with anxiety, dealing with insomnia, dealing with panic attacks, dealing with depression, for instance. And also more stress is clearly going to increase the risks and opportunities for infections to occur. And it's been clearly proven that increased stress is going to lead to increased risks of cancer. So the mind controls the body, and just dealing with the body sometimes does not give us the answer for improvement or cure or prevention. It really includes the mind, and a lot of people have a lot of things floating around in their mind that is not easy to remove and certainly impossible to remove with a pill. So Michael's work has been very important for me to share with people who are in all sorts of problems or issues to try and remove those. One layer at a time, and this is what I offer people. Some accept it, some don't.
Yeah, actually, I heard from a young lady that you introduced to us about 2 weeks ago here at this office, and when you introduced her, she had excruciating back pain to the point of debilitation, and the first 3 workshops that she sat in, or actually, pardon me, I should say came to, she had to stand up and walk around, and could sit for maybe 2 minutes. And I talked to her yesterday, and she said she was at a party with some friends and was able to do the splits and to do a backflip. Back pain, 100% gone, because she dealt with the issues that were going on in her life. And so the process of forgiveness is an awesome way to move energy around from within your structure. And that's what we're looking to do, to support people in becoming conscious of the kinds of energy that they engage in, the kinds of fears and rages and griefs and pains, and as Dr. Androcki says, the stresses that they think are not resolvable. And once you get to what underlies that stress, everything that's unlike love is resolvable. And so it's been just awesome to be here and participating in the medical offices with people with all kinds of conditions, emotional, physical, and watching resolution in every direction as people use the tools. What would be your understanding of how that works, Stephen?
Well, I've already said that the mind drives the body in so many instances, and issues unresolved in the mind can lead to diseases. I'm not sure in all cases. I'm not sure how this all fits together, but as I tell people on a regular basis, I'm not sure if this is going to cure your problem. But if it gives you any attempt at resolution, even if it's 5%, 10%, 20%, that removing the stress is going to improve the quality of your life, I think that that's a fair trade-off for doing some work and feeling better. Because so often when people have diseases, whether it be cancer or whether it be a chronic disease, that they have to become responsible for their own health. Diabetes, for instance. I'm not going to cure diabetes with mental work, but letting the person become responsible, that they can control their life, that they might be able to eat better, exercise, and do their work internally so that they can feel better, can make a dramatic change in the quality of their life. And I think that we're all looking at the quality of life issues. And this is the way that we do it, not with taking a pill, but by figuring out what is it inside you that makes you feel the way you do and taking the steps to remove it. And I can't do it. Michael can't do it. I tell everybody, we can't do your work for you. You have to do it yourself. So we offer them the opportunity to remove those issues that are causing their problems so that they might learn to feel better. And I think that's what health means to a lot of people. It's not the total summary of what health is, but you have to feel good and you have to have the right attitude to be able to deal with all of the issues on a daily basis, health and mental issues.
And, of course, the ancient Aramaic idea of forgiveness has nothing to do with letting other people off the hook for what's going on inside of them. In fact, if you're new to the show, we would invite you to go to the website, www.whyagain.com. And on the right-hand side, you'll see a link that says Download Worksheets. And we'd invite you to click on that worksheet. And what the ancient Aramaic technology of forgiveness does is it puts you in touch with the things that you've been pretending aren't in your life. The fears, the griefs, the rages that when the mind says, enough, I can't deal with this anymore, we hide away from ourselves. And most of the world thinks that once we're in pain because we've hidden something away from ourselves, and by the way, that's the only way we're going to be in pain is if we engage in something that doesn't belong in us, then we hide it away. We play this game that everybody else is to blame. And our mind goes along with playing that game. Our mind goes along with hallucinating the idea that somebody else is the problem in my life. And, of course, our favorite tongue-in-cheek line in that regard is, you'll notice if you've been through it 87 different times with 42 different people, you're the only one that was there every time. It's about you. It's not about them. And as you recognize that, the forgiveness reality management worksheet process from the Aramaic shows you how to get past the denial process. You know, you can go back as far as 2,000 years ago and you read in the book of James, stop your denial. You know, you look in the AA world, the AA groups, like the whole root of the problem is denial. And once we deny, we create a part of our minds over which we have no control, and that part of our minds is stored somewhere in our body, creating a distortion, creating a dis-ease process that if it remains long enough will tend to become reflected as what are called physical diseases. And, of course, if we're working from the side of energy systems theory and recognizing that everything is energy, then the energies that we engage in, the energies that we hide from ourselves, are going to have consequences in our physiology. the forgiveness process from the Aramaic puts you directly in touch with those parts of your mind and give you the opportunity to change those parts of your mind. Are there any particular cases that you've seen where somebody's touched into some issues that they didn't know were going on in their lives until they started to do the forgiveness work and created shifts and changes? Anything that particular that you'd care to share?
Well, I'm a great advocate of the worksheet process. I think that in and of itself it can be a truly remarkable transformation, and that's what I recommend to my patients. And when I have time, I will go through a worksheet with them. And some of my staff, who's been working with Michael and he's been here, also are very good for working through worksheets and explaining this. And a very interesting example is a lady that I've seen recently. And so many times when people get involved in their medical problems, that they think that there's not much hope, that they think that the pain medications are the only best solution for them, that no doctor has helped them. As a matter of fact, I talked to a girl yesterday, and I asked her, what percentage of doctors actually helped you? And she came out with the percentage very quickly, 5 to 10% of doctors, because she has a whole history of seeking help with physicians who weren't able to help her, and a lot of times the side effects of medications and the problems following surgery did not put her into what she was considering a positive return for the time that she spent with the doctors. Now, if she's creating these issues, of course, no doctor is going to be able to fix her, or if she keeps going to doctors and wants some medications, many doctors are willing to give her medications. But I had a very nice lady who's been having terrible abdominal problems for many years, and just incurable, terrible issues with pain and difficulty in eating. And she came to one of our work groups, support groups, and she sat through most of the session, and we gave her a book and told her that she can be in control of how she feels. And the last 2 times I've seen her has been an absolutely remarkable transformation, just with a very simple pattern of suggestions. One is that she can feel better, and I think that's very important. 2 is that she's in control of how she feels. 3 is that the intestines are very closely linked with the brain, and how she feels about herself and what's going on is going to affect her intestines. And 4 is that she can do work towards this. Now, this is not a lot of work that we've done with her, and it was just one evening, but remarkable changes. And I'm going to assume that remarkable changes happen. It's because of these facts. Could be other factors at play, but she's had this problem for a long time. So whether it be abdominal symptoms or whether it be stress, going through a worksheet can make a transformation, that there are things inside a person that can be improved through the forgiveness process, that lets the person know that they have more control over their thoughts than what they ever thought they had, and no one's ever told them this information. So story after story comes to mind about how this works, but the process of doing a worksheet, the process of when something comes up to do a worksheet and working through many issues can lead to dramatic changes in how the person feels about the problem. Whether the problem remains or not, it's still how they feel about it, and I think with a lot of work that issues will start to turn around and get better.
Definitely. Jeannie, do we have any calls or any comments in the chat room?
Okay, there's not really any comments out there yet, and people are just listening, but I have a comment or a question. I know in this work we have seen lots of times, where people are very resistant to doing their worksheets and doing their internal work. And it just kind of came across to me as you were just talking, Stephen, that you were talking about this lady that had gone to so many doctors and everything. Do you see a lot of patients that kind of skip from doctor to doctor to doctor, trying to get the doctors to fix them so they don't have to look at themselves?
Well, I think that most people come expecting the doctor, physician to fix them. And I think that most people come expecting a medication to fix them. Now, we're going to separate the injuries and the people who are involved in accidents with broken bones and lacerations and need for immediate surgery. But most people who come to the doctor have some sort of pain and are seeking improvement. And so they're looking for us for improvement. And most of the time they feel that it's going to come in the form of a pill. Now, I don't have statistics on how that happens. I know that pain is the reason that people seek medical care. But they are expecting we have the answers, whereas a lot of times we may not have the answers depending on how complex the problems go and what their beliefs are. So many people actually believe that their problem has nothing to do with them. And so many times it really has something to do with them, and unless somebody ever lets them know this, and that's the fascinating thing about Michael's work, is that how many times in the past have we been even told or in any form empowered by the fact that with our mind that we can make changes that can make us feel better and to help us. We counsel people on eating healthy and exercise for diabetes, but I don't think that really comes across as something that they can do to help themselves, because if they would actually believe that, more people would be taking better care of themselves. And we just don't see that happening. So there has to be something that happens inside to make a person know that what they do affects the quality of their health. And so often that when they go see a physician or any type of practitioner, they're expecting that visit is going to make them feel better as they leave with a prescription to make them feel better. And it would be a wonderful thing when people come in to see any physician and say, I have an issue and I have some problems and I would like some help in making this better, and I want to work with you to make it better. But no one's ever come in and said that. Everybody comes in and says, what do I need to take, or how can you make me feel better, and instead of having any partnership with the doctor.
So what I'm hearing is, as a physician, you'd love for somebody to come in and say, Doc, how do I heal, rather than, Doc, can you fix me, or tell me what's wrong?
Well, it's something I've never heard of out of thousands and thousands of patient contacts. I'm hoping that that's going to happen in the future. I'm hoping that happens everywhere. That what can I do to help myself, and how can I become responsible for my health, and how people begin to understand that they're the most important person that's involved in their health, and anything that they can do to help us, I think, really helps them.
So am I hearing you say that you, too, have run into people who say, I have nothing to do with what's going on in my life, it's all somebody else? I mean, have you heard that before in your practice?
Well, it's so often that after spending so much time with Michael, I can ask a few questions and ask, how was your childhood? And so many times that people say it was great, and they really don't understand all the things that maybe they should understand about how they develop their views for life and for health and for how they need to take care of themselves. And so many people, I think, are in absolute true denial that they have anything to do with what's going on. And even, I've been doing this for many years. I've been doing this through courses with Deepak Chopra and meditation courses, listening to John Kabat-Zinn. For many different approaches, trying to help people, to give them information to make them more responsible. It's just a difficult thing, and none of us people have and teachers have ever really said that you have to be responsible. They can say you should meditate to make you feel better, but not until I hear Michael talk and his work and saying that you really want to go back and to understand that these things that pop up that upset you are caused by you, and you need to do some work on that, and that may lead you to feeling better in so many different ways. So this works in all cases, whether it's a abuse case, whether it's a chronic pain condition, whether it's issues with their spouse, that they are having panic attacks, but only in those people that are willing to accept the fact that they have to do some work. And the question initially was, do you meet resistant people? And the fact is that, yes, I meet more resistant people than people who are willing to accept the fact that they can become responsible and they can actually change the course of their health.
So the ratio will probably be about 99 to 1. That's kind of been my experience over the years, and until people build the brain cells for, taking responsibility doesn't mean I'm to blame. It just means that with responsibility, I can find the part of me that keeps setting this up over and over again, and therefore have the ability to change it. And that's such a powerful transition when people are able to hear that. And then the change, the evidential change in the mind, when people start delving into themselves and seeing the hidden parts, the parts that are in deep need of healing. Is there ever a time, from the point of view of your medical practice, that you would say that forgiveness would not be appropriate for somebody?
Well, as I said, in any situation that a medical condition, that I don't know of any medical situation that is would you considered even somewhat important, that is somewhat serious, that is anything other than simple. I guess that someone came with a splinter in their hand, and I took a splinter out, and the problem is solved, or a foreign body in their eye that is removed, that I think that the forgiveness is not instrumental into what I've done. However, going a few steps forward and saying, hey, how's life? How's your stress? And finding out that they do have issues and they may be interested, I think that's a great opportunity and opening to say, hey, there's something that I know about that may make you feel better. Why don't you go to this website? So when we see people, it's not always for specks in their eyes, and it's not always for something simple that's easily removed. But sometimes it's for their overall health and well-being, and the next following questions can get to the point that we can ask them, do you want to learn how to feel better?
Yeah, we have a question in the chat room for you, Dr. Androcki, and one of our regular listeners, who's a person who does support groups in Springfield, Missouri, Sam Brotherton, says, I would like to know how Dr. Androcki works with people who are only willing to look outside themselves and think medication is the only answer. There's so many who thrive on the victim role.
Well, it's true, and if you do this and you work with people, you already know the answer. And Michael already knows the answer. He already told you his ratio is 99 to 1. The only thing that we can do, and this is Michael's words, is we hold the space. We let them know. And sometimes when a person leaves, and sometimes on the exit, I say that simply that you don't have to feel like this. And I like those words a lot. There's no need for you to continue to feel like this. And maybe after they've heard that for a few times, that it might sink in and they might ask a question. But then again, if they're into their need for narcotics, believing that's the only way to improve the condition, just leaving that open is the only thing I can do, because we can't force them to show up any place they don't want to and to do worksheets if they don't want to do them.
Well, there's an awesome film out right now for several reasons. I think it's pretty powerful. It's called The King's Speech, and it's about King George when he was forced to take the throne in England, and he had a speech impediment. And for one thing the movie shows is how, nobody's any different. We all do the same stuff. But there's an awesome scene where his therapist, who's a speech therapist, who's kind of unconventional, and really helping to heal him and helping to support him, And what he does is he finally confronts the king with what his real problem is, and he just gets right in his face and says, you need to deal with your fear. And the king just rises up. He's not king yet, but he's getting ready to be. And he just rises up like a vampire, and he pukes royally all over this therapist who's done nothing but support him and assist him, because the therapist is bringing him face to face with what he really needs to deal with. And of course, when stress goes up, when people are presented with truth, the tendency is for most people, is to get rid of the source of the information they don't want to look at. Have you ever presented somebody with a kind of a confrontive situation you really need to deal with, and had them respond like that?
Well, people come to me for some sort of comfort, and it's really difficult to put a challenge. But occasionally I do, saying that you have some problems that you should deal with before you feel better. And I'm not sure that that's the most effective way. I think it's more of enticing them to come forward. And we had an interesting situation with someone that I work with who seemed to be very resistant to coming to one of the classes and workshops that Michael gave, that just through persistence, just through talking to him, he did show up and made a huge transformation. So I think that we always try to, and I think that Jesus spoke about this in the Bible, that you put the word out, then you hope that people will follow. And I'm putting the word out that I'm doing this, and most people sooner or later are going to face the situation of needing to deal with something and understanding there's something behind this. And when they do, then it's the perfect opening to say, you can start to feel better, and if you work on this, that you might be able to understand why the way you're feeling. So I like to leave it open for the people and be less confrontational with them and support them in the meantime, and not to close any doors, because those people that need it the most may be the most resistant, but through slow, gradual work and assisting them, that I'm always hoping that they'll come over and they'll show up to one of our study groups.
That actually introduces the next thought I had, and that was, you and your wife, Claudia, run two different study groups on the forgiveness process in two of your different offices, one of them in Spanish, and we did a video recording this past weekend of Why Is This Happening to Me Again in Spanish with Dr. Androcki's wife, Claudia, translating. So we're working on putting that together to make available for the Spanish community. And then out in Pahrump, Nevada at Healthcare Partners, the first and third Thursdays, I believe it is, you have a support group there. Anything to share on the support group angle, your experience with doing that? There are many people out there who have thought about or have started support groups, and of course sometimes it can be a challenge.
Well, certainly the challenge is to let people know that they can change and that they have to show up and do their work is the biggest challenge, because some people like to make excuses for why they can't be there and why they don't have to do their work. But we leave this open, and sometimes we have a lot of participants, and sometimes we have a few. But those nights and evenings that we have a few participants, we have to say that tremendous work gets done on those people when they have a very small space to work with the facilitator, and we've seen tremendous improvement. So all in all, it's been wonderful. We do large groups of people, and sometimes small groups of people, sometimes only two people, and every time it's been extremely valuable and extremely revealing. One of the ladies who had bad abdominal pain brought her son, and I ran into him yesterday, and he was willing to come back to another session, just because he knew and understood through the little bit of time that he seemed to be paying attention, that he needs to be responsible. So now that he has girlfriend problems, that he understands that there is something for him to do, other than the things he's been doing and understood for all of his life, that he can become more responsible and feel better. So even if they come with their parents, even if they come and they're not so interested the first time, that we always leave that opportunity open for additional opportunities to explain further that puts them in control.
Yeah, we've got some comments going on in the chat room about the healing process and how, as an energetic system, when we build vitality, when we do our work, there is a process of release that takes place, that the energies that went into the structure have to pour back out of the structure in order for us to be freed of them. And actually there's a show that we did back, I believe it was in April. Oh, Jeannie just put it in. Oh, she just put a link in. She's so awesome. Anyway, you can click that link, and there's an archive where we spent the whole show talking about what healing looks like. And, of course, one of the reasons it's not very popular, and one of the reasons why people don't particularly want to pick up a worksheet, is because it's not Dr. Feelgood. You have to deal with what's there. And, of course, as a particular energy, be it grief or fear or pain or rage or hatred, went into the system, it's going to look the same way as it comes out. And the whole idea of the worksheet process is to stay conscious, and instead of getting lost in those things as you're conscious and go through them, you come out the other side. But there is a link there on the site, and if you're not, they're in the April 2011 archives. April the 15th and April the 18th, there were two different shows we spent talking about the healing process and what the symptoms of healing are. And the willingness, of course, is the cosmic grease that allows it to happen, the willingness to be responsible, the willingness to become acquainted with parts of your mind that you didn't even know were there. We actually have another friend in Florida who's a cancer specialist, and one of the core things that he does with people is forgiveness. And we worked with him back several weeks ago when we were in Florida. And as he did, the form of forgiveness that he's worked with people was the I'm letting you off the hook type of forgiveness, which is, of course, Greek pardoning and not forgiveness at all. And when we introduced him to the forgiveness process, and he actually did a worksheet, he was quite surprised at what he found in his own mind. And most people are. And of course, if you start to explain to people what the obvious issue is, most people say, well, that's not true for me, because if that were true for me, I would know it. It's like, well, that's why it's called the unconscious, because we don't know it, and there are things we don't know about ourselves. Is there any particular situation where you've seen someone who discovered something about themselves through the forgiveness process that made a major shift in their lives that would be worth commenting on, that might help inspire people who are listening to understand the process?
Like you explained it clearly, that you never know what you have tried to hide away to keep it away from you, but very commonly when I start asking the probing questions of have you ever seen anybody act this way, the way that you're acting, or be in fear, or to have anxiety, I think that more common than not, people are going to deny that. I think that they want to believe that they're unique and that this is all a very personal issue. But with additional questions, we typically are able to find out that, yes, there are situations, and the leading question is, have you ever felt this way before? If this is the way you feel now, have you felt this way before? And where does that start? And that's part of the worksheet process as well, that this is not a unique feeling, the feeling of, for instance, depression, that there's no way out, and the feeling that the person may not feel good about themselves or have poor self-esteem. And there may be origins to that, but it takes a little bit of probing to let them discover other issues that they've tried to avoid, that they don't want to think about. And only when they know that being able to go back and search for these similar type of thoughts and emotions, are they going to be able to rid it and with the worksheet process? So it's always that line of questioning and the person's willingness to look at these things that we find this out. And of course, all the time that there are issues and I don't know any time that I've ever found that the person has never actually felt the same thing that they're feeling when I'm talking with them when they're trying to explain their condition that they've never felt before. It's probably not a unique experience.
For sure. And if there's anybody who has a question, we'd be delighted to hear from you. Our call-in number is area code 646-200-4169. 646-200-4169. We'd be delighted to hear from you. If you have a question for Dr. Androcki or myself or for Jeannie about healing, about the process of being responsible, we would be delighted to hear from you. Give us a call. And Jeannie has a comment for us.
There was just a comment earlier that it has been programmed into us to look outside for solutions, whether it's a mental, emotional, spiritual, physical problem. And so even with physical issues, it's like habit for some people to continually run to the physician to fix even little things. And do you ever see that if they don't get an answer from one doctor, then they go to another doctor, and then they go to another doctor, and until they can find somebody that hopefully can come up with their solution? That it sounds like, and accolades to you, Dr. Androcki, for being willing to step out there and say, hey, do your inner work. I mean, because aren't you pushing some patients, if they heal themselves, aren't you pushing patients away? Or do you ever think of it as that respect?
Well, I'll answer the last question first. And, of course, this is my job. There's nothing that's more satisfying than to have a patient that no longer has problems. So it's not a financial commitment. There's enough people that need help that they continue to stream in. It's the people that are improved and who finally get it that give me the strength and opportunity to continue doing what I want to do. It wouldn't be very satisfying if no one ever got better. And, of course, even to any specialty, oncology that deals with cancer patients and children's oncology, which is a very difficult specialty where you're dealing with the children with cancers. You always want to see somebody get better, and that's what is our driving force. But you ask the question, do people go to different doctors trying to find out what they want? Well, of course, and they go to different churches to find out what they want to hear. They go to different parents when they want to find out what they want to hear. They go to different relatives. They go to different girlfriends till they get what they want. And so that's the natural progression for people to continue searching for what fits best for you. And Michael explains it best that we're searching for. We know what we want. It's already inside us, and we're just using the psychic megaphone to attract it in and to make sure that what our thoughts are resonating with somebody else. And that is so true with my experience with dealing with patients. And I just had a young girl who said that she was in an abusive relationship. I said, I'm sorry about that. That happened before. She says, yeah, that was my third one. And so really there's a pattern to this, and until Michael explains it, that I suspect that the next one's going to be abusive, although she says that, no, everything is fine, he's a sweet guy. And there's ways to break that. So people go from person to person and physician to physician looking for what they want. But I'll give you a perfect example. This is a very bad allergy season in the Southwest. Lots of winds and pressure, and for the past few days I've been seeing a lot of people who have swelling in their nose that causes their eustachian tube to become shut, so they have ear pain and sinus pain. And so many people come in and they really want antibiotics. I mean, this is on their mind that they really need this antibiotic and this one really works. And the fact is, antibiotics have nothing to do with what their problem and issue is, and antibiotics don't work very well. They have side effects and problems associated with them, but they come in knowing what they want. And it's always disappointing to them when I try to explain that antibiotics are not going to help you, that if you deal with your allergy symptoms with antihistamine, take it when you need it, and it's due to the pressure, and there's no infection in your ear. Everybody believes that their ear is ready to explode, full of pus and redness, and it looks perfectly normal. It's just that the pressure has pulled it in. So they've imagined this in their brain, like we do with so many things. They imagine what they think is going on, and it's not true. And I'm not sure that they really leave disappointed. I explained that get problems to come back. But sometimes it's a difficult pitch to let them know that antibiotics are not going to cure the problem, although it would be a much simpler job for me to say, let me get you an antibiotic and get you on your way, and to have more time so I don't have to explain all this, but it's still my obligation to let them know what's best for them.
Well, my accolades to you for being a physician who cares enough to offer that to people. And I think oftentimes the deeper levels of healing that happen as a result of the caring of the physician, and there are so many out there that really hold such a space for their patients and such a concern that amazing things happen in that relationship. Jeannie has a comment for us.
Oh, that just made me think Claudia, Dr. Androcki's wife, had shared with us the other day that she had seen repeatedly, he just walks into the patient's room and says, so what's going on in your life? And they just start bawling, just break down, and they're definitely holding that space.
Yeah, and the willingness to take the time that it takes to do that, and to really care enough to look into people's lives is such a gift to give. And, of course, the original meaning of the word physician is teacher. It's not just about offering a prescription, but rather is about teaching people how to handle their lives and deal with their lives. And so you're an awesome example for doing that.
And then I could take the opportunity to say that there are great physicians and physician's assistants and nurse practitioners all over the United States. And if you haven't found one, you really should. If you're in that need of requesting help with your health, I'm sure that a lot of people listening to the radio and following you don't have a lot of health issues, but of course you have unresolved problems. You very well may have health issues, and circumstances come up that you are going to need to seek medical care. But there are physicians and medical providers that do care. There's nurses that care, and people are people. And some of them are going to be less than talkative. Some of them are going to be less than affectionate and less than helpful. But there are other ones who are there to help you. And finally, on that point, is that if you know what you want and you know what you're looking for, then you should be part of the solution and to present to your physician with that openness to make that better. And so many times, when Michael tells the stories, and when we understand that when we deal with people who are not very happy, to give them some kindness and to support them and to assist them, that may be part of the thing to make the relationship improves, especially in your case, and maybe in all the future cases, that offering support to the person. And this can be a very difficult, weary position, as listening to people in pain and with complaints. And what you take to the doctor is going to be important to what you receive.
Stephen, what do you suggest to the person who does go to the doctor with some knowledge and some awareness and real questions, and they're just put off by, I know best, and I've run into many people over the years that's the kind of response that they get. What do you suggest that they do in that sort of a situation?
Physicians or doctors? I mean, physicians or patients?
The patient.
The patient. It's, for instance, let me give an example, that in the past 4 weeks I've seen hundreds of people with ear pain and with sinus pain, and this is what I do. This is what I do on a daily basis, is to deal with these issues. And when a patient comes in and convinced of something else, and I'm pretty sure, as my knowledge base and my experience and my recent experiences for what's going on, I'm pretty confident that what I have to offer is the best solution. But if you come in with the need to be right, if you come in with doing your research on the internet, believing that you have a middle ear infection and that you need a tube in your ear, it's going to make it really difficult for me to unconvince you. And that's the way that the mind works. You always want to be right, and you don't want to bow down to anybody else's recommendation, even though they're considered the specialist at that point. And I think that if you have an issue with before you go see a physician and you have anything inside you of upset or fear or any other issue, I think that's the perfect opportunity to do a worksheet before you even go to the physician, or take it with you in the waiting room, so that you can understand that what you're going to be giving is going to be part of what you're going to be receiving.
So you run into people, too, that just want to be right? No, you're kidding, Steve. And we have also Dr. Tim Hayes on the line with us. And Dr. Tim, from your point of view, being a psychologist that works with people and has done so for about as many decades as Dr. Androcki, what kind of input would you have at this point into our conversation?
Well, I would have answered the question that Dr. Androcki just answered by saying it's really important for every person who goes to a doctor to be a good consumer, to know what their expectations are, not assume they're right about everything, but to be willing to walk away from a doctor if all the doctor wants to do is meet with him for 3 minutes and write him a prescription. At the same time, if the doctor has a real good set of experience and is trying to explain to me something, and all I get is angry when the doctor is talking to me because he's not going to give me what I want, then I have to agree with Dr. Androcki. The thing to do is some worksheets. You know, I tell people that in order for any kind of therapy to work, you have to have two things: somebody that knows what he or she is doing, and someone with whom you're comfortable. Because if either of those two pieces are missing, you won't stay in the room long enough for that person to help you, even if they're the best therapist in the world. So it's a package deal, and we really do take as much with us of what we're going to get out of it. You know, it gets reflected right back to us. And if I go in angry, my chances are I'll come out angry. I'm relieved that we've got, Michael, you've got a couple medical doctors now who are willing to prescribe the set of worksheets and the other tools, because as I've been doing for the past X number of years in my practice, it ends up being very empowering for people to not just have me as a coach, but actually have the tools that they can use in their day-to-day lives, even when I'm not there, to help move through problems, move through negative energy, and it's just a fabulous set of tools. It makes my job easier. I've heard you say that Dr. Androcki is one of the people who says, you know, it's the same answer for almost every problem. You do your worksheet process, undo the negative realities, and you start having a whole different experience of life. It's the same thing in the therapy realm. Most of the time it comes right back down to the same process. Sometimes people don't want to hear that, as we were talking about earlier, but it's for those who are willing to hear it and do the work, the results are off the charts.
I'm hoping that there are other physicians that are looking for a tool similar to this, because I ran into Michael by either what you call a cosmic coincidence or divine revelation as I was wandering through a series of lectures, and happened to end up in Michael's presentation, But so many people don't know that these options exist, and just with a little bit of work and understanding that they're responsible for their own feelings, for the physicians as well as anybody who's in pain, and that directing them to the website and possibly having I Am Somebody or My Commitment available or a worksheet available is really a terrific tool for those people who want to hear something like this. And amazingly, there are people that are ready for this work, and they're scattered all over the world, and they know that this is possible, but nobody is giving the opportunity to give them the tools. So physicians can do it, and any of the listeners, I think that's what I think. I'm not doing anything that you can't do when you run into a person that is having issues or problems, especially in your own family. It's really time to do the same thing that I'm doing, which is to let them know that they don't need to feel this way, and that if they start doing their work and start learning the worksheets and reading and understanding that the problems are created in their own mind, that they can start to feel better. And I give the challenge. I'm not doing anything that you can't do, and I challenge you to help as many people as I'm helping, and start with your house and the people around you and your family.
And then go on and start a support group. Michael was asking for testimonials earlier in the week or last week, and there was a woman in our support group last Tuesday who, at the end of the group, she wouldn't let us leave until she announced that she was ending a school year. She's a teacher, and this is the first school year in 8 years that she hasn't had multiple hospitalizations for lung problems and what she was calling genetic lung disease or dysfunction. And she's been doing the Michael Ryce worksheets and the emotional freedom technique tapping for a little over a year, and she made it through the entire school year without a hospitalization. So there's a dramatic impact on a physiological process that's related to her emotions and being able to process them and get her energy flowing rather than simply pump herself full of steroids.
Absolutely. The process, when I first met Jeannie, she was lived on an inhalator. It was in her purse all the time. I don't think she's had her fingers on one in almost 6 years now. And it's due to the willingness to forgive, make some simple changes in dietary regimen, and it's amazing what can happen. And, if we live in a drugged existence, if we live in an existence of when I say drugged, I mean the culture's drugs. I mean the caffeine, the nicotine, the sugar, the junk food. The illusion of well-being comes from the drugged state in that regard. And oftentimes the person who lives in that state is the one who, goes through 40, 45, 48, 49 years, and all of a sudden one day they walk into the bedroom and there lies a person dead from what they call the heart attack, that the heart attacked them, which of course is quite an interesting commentary. But when one decides that, okay, I'm going to start to get rid of the junk, I'm going to clean up my dietary regimen, I'm going to clean up my thoughts, I'm going to forgive, I start to access things that I, in my life, have not accessed and have always found a way to suppress, always found a way to lock down. So when I make a shift, the early stages of that can be rather unpleasant. Have you ever run into that? And Dr. Androcki, have you ever seen somebody as they start to clean up their lives, all of a sudden they're like, well, gee, I've got all these symptoms now. What's wrong? What have you done to me?
Well, fortunately, I haven't seen so much of that as the good stories. I don't know what the reasons is why people would stop. They've never told me that before, but anything is possible.
We also have another question out there. Was Dr. Androcki doing this with his patients prior to meeting Michael in a workshop, and what did you think of the work when you first met Michael?
Well, the first question is, of course not. How could I know what I don't know? And I had no idea that this was possible. I was listening to Deepak Chopra. I was listening to John Kabat-Zinn, exploring meditation, yoga, and things like this. But that does not get me to the ability to teach other people. Most people have difficulty in taking time to do worksheets, but yet doing an hour of yoga or meditation is just completely something that they can't schedule in. If they thought it was important enough, still they might not be able to do it. So I didn't know about Michael's work until I met Michael, and it took a while to sink in, but as I've explored many things, I'm trained in hypnosis and have worked with people with behavioral issues and deal with a lot of depression issues. I was finding that was not helping them nearly as much as giving them the tools to work through their issues.
And by the way, we are still in the throes of a codependence conversation. I think we've done 6 or maybe 7 shows now around the codependence issue. And 2 days ago started with the 12 steps to interdependence. And so we've done 2 shows on that, and we'll go back to that tomorrow. We've taken an intermission from that interdependence conversation to spend some time with Dr. Androcki in his office here in Las Vegas, Nevada. But tomorrow we'll go back and we'll look at the other 6 steps of moving into interdependent relationship. And for anybody that's in the Las Vegas area, we have a scheduled 2-day intensive out at a place called Tacoma Hot Springs, actually coming up in about 10 days. If we have the participation required to put that one together, then we'll be working with the tools of course, WISE is happening to me again, the forgiveness process. We'll step into communication. Did you hear what I think I said, the 7 steps of responsibility communication? That is such a powerful tool for turning people's relationships around. And Empowered to Heal, we'll look at the Aramaic Beatitudes and do some mind shifters and still point breathing. So anybody who's interested in that could contact us through email or via the telephone or come on the radio, and we'd be delighted to speak with you. Dr. Androcki, we're getting close to the end of the show. Any other input or wisdom from your medical experience that you'd like to offer people who are interested in the conversation that we're having and moving forward in their lives, whether they've got physical diseases, mental, emotional, relationship, financial, any particular input you'd like to offer them?
I like to say that we're still in the dark ages of medicine. We don't know what's available in the future, and I think that clearly the mind has been on the forefront for the past decade or two, that the importance of the mind. Lance Armstrong talks about this. There's many websites that talk about this. The willingness to live, the willingness to improve are going to be important, but what's inside us that we give up, that we believe that we're not worthy, we believe that we don't have the power to heal, and these programs, I think, inside us are what is affecting people's chances for improvement in so many things. And the simplest, easiest way that I know to get to the point of being responsible for your thoughts and taking care of those upsets that are inside you is to do Michael's work. So my recommendation is to seek medical help when necessary from a physician that you feel comfortable with, and do your own work, and don't expect that we always have the answers for you. It's going to come in the form of a pill. And we're hoping that more and more people get involved in this, and more physicians get involved in this in the future.
Well, that's a great point, too, because, of course, as you say, we don't know what we don't know. And when you look at the ancient Aramaic technology, it was so well squirreled away and hidden away when it came through the Greek translations that it's been virtually missing from the West for almost 2,000 years, and that's the work that Jeannie and I have chosen to do, is to bring it to every mind on the planet. And so one of the things you might do as a listener is introduce your physician to the process of forgiveness from the Aramaic. I know that Dr. Androcki's given out, I don't know how many dozens of books over the years, hundreds of books, I guess. I can't count them. And, you know, it's interesting. We have actually he's retired now, but there's a gentleman who was an accountant in Beverly Hills, California. For several years, he was the number one purchaser of the book, Why Is This Happening to Me Again? And at tax time, what he'd do is every time he gave one of his clients a tax return, he'd hand them a copy of Why Is This Happening to Me Again and say, start doing worksheets. And so, pass the technology on. We're looking to take this to every mind, heart, and being on the planet. The book is on the website. You can download it free. The How-To of Forgiveness, if you've tapped into the show late, go to please www.whyagain.com. On the right-hand side, there's a link that says Download Worksheets. The instructions are there, and the worksheet, the first two links. You can download the book free. You're welcome to do that. And we are here to support you in creating the best year yet of your eternal life. That's our purpose for being here. Dr. Androcki, thank you for joining us today. It's been a delight, and we appreciate the support you've given us and the hundreds of people that you've introduced us to take this work and work with those shows. All right, blessings. Thank you.